Good morning, everyone. Welcome to this plenary session. My name is Professor Trent Webb, and I am the director of the Hofstra University Forensic Speech and Debate Team, currently housed in the Department of Writing Studies and Rhetoric. And it is my distinct honor and my pleasure to be here with all of you this morning. When Mina approached me several months ago asking the speech and debate team to be a part of this exemplary program, we were absolutely humbled and thrilled to be a part of it. I am so happy and to be here, but if I'm the least bit lethargic, I just want you to know that there's an actual reason for that. We are just 48 hours-ish back from our last national tournament of the year. And after enduring I think Kyle would remember, a nearly 4-hour delay out of Chicago O'Hare Airport, we're all still just kind of recuperating. But it was worth it because as we stand before you, these 4 members of the Hofstra University Forensic Speech and Debate Team are members of a nationally ranked team, fresh off of nationals, placing 8th place in Division II and in the top 24 overall in the entire nation at the national tournament. This is an exemplary achievement, and this are what we've deemed our Renaissance year of the Forensic Speech and Debate Team. When I came to this institution in late August of 2022, I had very limited amount of time to recruit, but I was blessed with a group and a collection of students who were motivated, who were bright, who were intelligent, which is pretty much par for the students here at Hofstra University anyway. And we were able to achieve some miraculous things over the course of the year. So for this particular event, we are pleased to do an evaluation of the Affordable Health Care Act. And as you'll see through the 4 students that are seated here, they will argue back and forth in a mock style debate that is similar to the type of debate that we do on the team, but it has been altered slightly for this particular event about the pros and cons of the Affordable Health Care Act. Before you today are 4 students who are members of the team, and I would like to briefly introduce them, and they will take some time to introduce themselves as they approach the podium to make their cases for both sides. With us today is Favor Chubozo Nwere, who is a neuroscience major, also an international student, and she excelled this year on the team in both limited preparation speaking and in public debate. So thank you for being here, Favor. Yes. Tess Kaus, who comes to us from upstate New York, is a political science major, and I think she has some other things as well that she'll tell you about when she makes her introduction. Tess also excelled in debate on the team this year, but also dabbled in the oral interpretation events, as well as in some of the platform speaking events, and made to the semifinals of, I think, most of the tournaments, at least the semifinal round of most of the tournaments that she debated at. So thank you for being here, Tess. Next up is Kyle Mistroni, who is a business econ major, but I was told this morning that there's a change to that. So he'll tell you about that when he comes up to introduce himself as well. Kyle this year excelled in platform speaking and also excelled in our limited preparation speaking events. And as I said before, Kyle also was at the national tournament we just got back from a couple of days ago. And I am pleased to say that Kyle is the novice national champion in extemporaneous speaking out of well over 120 students nationwide. So thank you for being here, Kyle. And certainly, last but not least, is Alondra Padilla, who comes to us all the way from Cali. She is an entering freshman, and she is also a political science major, and I think some other stuff as well that she'll tell you about when she introduces herself. And she excelled and competed in our platform speaking events on the team this year. So thank you for being here, Alondra. So I'm just the coach, which means that they do this public speaking thing a lot better than I do. So I'm going to turn it over to them and let them get started.
Okay, I want to start off by thanking everyone for being here today. He's correct, there's some things that they left out. So I am a double major in political science and Spanish, and I'm also minoring in philosophy for pre-law. And once again, my name is Tess Kaus. And before I begin, I'd like to give a brief introduction. So today, my partner and I plan to lay out the numerous benefits that the Obamacare system offers. So in order to accomplish this goal, we will demonstrate 3 key areas in which Obamacare has excelled. First, the Affordable Care Act created exponential economic growth for all and lowered the federal deficit. Second, Obamacare has made healthcare more accessible and affordable for all people. And finally, the rising popularity of Obamacare and how it continues to prosper in the aftermath of COVID-19. Thus, we will demonstrate how the positives of Obamacare vastly outweigh the negatives in this regard. So to begin, the Center on Budget and Policy Priorities demonstrates how the Affordable Care Act greatly reduced the United States federal deficit, even despite cuts that were introduced in December of 2020. President Obama argued that he would not add to the deficit, and he was proven correct in 2020, where the CBO's final cost estimate showed a 10-year overall deficit reduction of $143 billion. Secondly, the Affordable Care Act has reduced income inequality in the United States, proven by a 2021 study from healthaffairs.org, which demonstrated that gaining Medicaid coverage eliminated out-of-pocket healthcare spending and increased average income in the federal poverty level by 18.8% in the 10th percentile. Another study proved that Obamacare greatly succeeded in reducing income inequality within and between groups in regards to race and ethnicity, education, and age, with the largest statistics appearing in states with Medicaid expansion. Lastly, these reductions led to a decrease in personal debt translated in the realms of disposable income for expenses including rent and mortgage payments, creating lower eviction rates and filings for beneficiaries. Per my second contention, Obamacare has made healthcare more affordable, where in 2020, AmericanProgress.com stated that 87% of enrollers qualified for financial assistance with premiums, and 54% received reduced cost sharing. Additionally, the average premium owned was just $87 per month after enrollment, which was previously $612 per month. Obamacare also eliminated co-payments across almost all public and private healthcare plans, allowing beneficiaries access to contraception, cancer screenings, immunizations, and more without out-of-pocket payments. This is coupled with the fact that Medicaid expansion was associated with 19,200 fewer deaths among older low-income adults and has protected those most vulnerable and ignored in our society with pre-existing conditions who were not previously covered, which accounts for roughly every 1 out of 2 non-elderly people in the United States. Another groundbreaking aspect of Obamacare is that it has greatly expanded rights for those not previously protected, such as women and minorities. Obamacare paved the way for healthcare discrimination to be prohibited on the basis of race, color, national origin, age, disability, or sex in all respects. Moreover, the required plans cover women's preventive health services, including birth control and counseling, well woman visits, breast and cervical cancer screenings, prenatal care, interpersonal violence screening, and counseling with no cost sharing. And the newly created Medicare-Medicaid Coordination Office serves people in both Medicare and Medicaid to make sure duly eligible individuals have full access to seamless, high-quality healthcare and to make the system as cost-effective as possible. Lastly, Obamacare has become more popular as the years have passed, especially after the tumultuous COVID-19 pandemic, where it was greatly utilized. The Biden-Harris administration announced a record-breaking 14.5 million people have signed up for the 2022 healthcare coverage during the open enrollment period, which was extended to January 1st. This falls directly in line with the data from Statista.com, which demonstrates that in March of 2023, 62% of those polled stated that they viewed Obamacare as favorable. The Kaiser Family Foundation estimated that nearly 27 million people lost employer-sponsored health insurance in March and April of 2020. Thanks to the Affordable Care Act, 79% of those people are eligible for coverage through the health insurance exchanges or Medicaid. As such, the Affordable Care Act is directly responsible for saving millions of lives during COVID-19, a time that surely would have been detrimental to those who could not afford health care, had no means of accessibility towards getting better, or even be considered due to pre-existing conditions without the help laid out in the Affordable Care Act. So as demonstrated, the Affordable Care Act was and continues to be a major delivery for affordable and accessible care for all those who were previously deemed ineligible to reap the benefits they so desperately needed. Not only has this plan worked in regards to economic deficits and reducing costs, but has also ensured that each individual citizen, regardless of their characteristic or income, has the fair chance to live a prosperous and meaningful life, and has encoded laws for these changes to continue to be felt, even 13 years after President Obama so brilliantly introduced them to us. Thank you, and I'm open for cross-examination.
Hello? Okay. Hello, my name is Favor Chibuzenwere. Thank you all for being here. I will now start cross-examination. So, would you say that the Affordable Care Act missed this mark when its mandate, with this mandate because it caused people to pay fines even though they didn't have health care?
Well, first, I'd like to point out that this was repealed in 2017 and went into effect in 2019, so I don't believe it's a relevant issue as it stands. However, I don't believe the mandate was entirely without reason. The mandate helped to control costs because the pool of younger and healthier customers helped offset the healthcare expenses for those who were older and sicker, meaning that it was a utilitarian action in my view. So I would say that it was done for the greater good of those who needed the most care and consideration.
Okay. How do you respond to the criticisms that Obamacare has increased healthcare costs and decreased the quality of care?
So once again, this occurs when enrollees are older and sicker than the general population. And I like to point out that before Obamacare was in effect, individual market insurers in most states could protect themselves against this kind of scenario by denying coverage to those at risk for high spending. They charged sicker and older people higher premiums, and they excluded coverage for specific pre-existing conditions and more. So I believe with some research, anyone could see the intent and application of this was necessary to a large extent.
Do you think that the individual mandate, which requires individuals to have health insurance or pay a penalty, is an effective way to increase healthcare coverage?
I would say in a sense, yes, but I would once again also argue that the overarching theme of this argument does not do justice in comparison to the millions of people that have benefited or received coverage because of the Affordable Care Act. Once again, it helped those most vulnerable in our society, and it places first the populations who need the most help. So I would say that it was necessary for that part in protecting them.
Okay. How do you think Obamacare has impacted health disparities in the United States, particularly among low-income and minority populations?
Well, I have some statistics I laid out for you previously that I can go over. So first, once again, it brought down the average premium from $612 per month to just $87 per month, which ensured that nearly 35 million people today have coverage they otherwise would not have and had to suffer through the high cost of premiums and prices that they could not afford. Not to mention that the Affordable Care Act has led to a significant drop in the number of African Americans and minorities who are uninsured overall, and has ensured protections by encoding protections for all minority groups on the basis that is deemed unfit and understandard, meaning that someone cannot be discriminated against in the healthcare system just based on orient or race alone.
Thank you. That concludes my cross-examination.
Hello, everybody. I'm Kyle Mastroni. As Dr. Webb alluded to, I am a economics and political science double major with a minor in business in the class of 2025. And today I am proud to represent the negative side of this argument. I'm first just going to get my timer ready. Turn my alarm off. All right, now let's get into it. Today, my partner and I plan to highlight the critical flaws that exist within the Obamacare system, specifically the structural flaws. To do this, we will examine Obamacare through 3 critical points. First, Obamacare's inability to complete its overarching missions. Second, Obamacare's inaccessibility to the public. And third, the lack of enforcement mechanisms within Obamacare that ultimately rendered it ineffective. In doing so, we will clearly highlight how the negatives of this bill outweigh any positives. But first, Obamacare ultimately fails as a bill because it does not complete its ultimate goals, which according to the National Library of Medicine was to quote unquote reform the private insurance market as well as to mandate health insurance. First, we see how Obamacare failed to do this through the existence of a counterproductive grandfather clause within Obamacare. eHealth on October 13th, 2022 states that anybody who had an insurance plan before the creation of Obamacare did not have to have that plan change. The reforms that Obamacare presented were not applicable to these plans, and therefore the reforms that Obamacare required were minimum at best. Next, the ACA could not accomplish its other primary objective, which was to mandate and guarantee health insurance. We see this from the fact that today, over 27.5 million people are still uninsured, according to an article by the Kaiser Family Foundation on December 19th, 2022. Even with an individual mandate that was requiring people to be insured or to face a significant fine up until 2019, Obamacare still could not mandate that the public had health insurance. And that means that it was unable to accomplish its ultimate goal. What we see is critical policy failures that represent an overarching theme within Obamacare. The theme that it had great aspirations, but the fact of the matter is that it set clear goals and failed to reach them. And because of this, it must be deemed unsuccessful. Next, if Obamacare could provide the benefits to the public that it wants to provide, the bill still was highly inaccessible. We see this through how Obamacare fell into the classic insurance pitfall of being unnecessarily complicated. When the Brookings Institute found that only 39.9% of Americans understand critical healthcare related terms such as co-payments, premiums, and deductibles, it's obvious that the first thing that Obama needed to do was to make sure that the healthcare system was clear and understandable for the public so that they could navigate it properly. However, Obamacare did not do this, and in fact might have made things worse. We see this from Healthline as of August 14th, 2019, where we see that Obamacare was just as confusing as the private market. We see this through various plans with minimal yet significant differences that could easily trip up an uneducated consumer, as well as a registration window that was too restrictive for most consumers to properly use, lasting only from November 1st to January 1st. 2 months out of the entire year where anybody can enroll for Medicaid is not enough and was too restrictive for the average public who would need insurance all year round and not just register in November. Also, Obamacare used the same rhetoric and language that we saw in the private healthcare system that was confusing in the first place, and therefore did not make anything easier to understand for the public, but only worsened the flaws within the private system. In fact, things were so bad that Vox News reports that 6.5 million Americans decided that Obamacare was so confusing that they would rather just take the fine that Obamacare put on them rather than try and adhere to the system. The system that the system that was designed to help people ended up just being a nuisance for them, and they didn't want to use it. And that is as clear of a sign as any, that Obamacare struggled as a bill. And through these high levels of inaccessibility, we see that Obamacare was just as much of a labyrinth for the private market or just as much of a labyrinth for the public as the private market. Lastly, even if these critical flaws did not exist, Obamacare lacked any enforcement mechanisms to actually ensure that the bill's mission could be realized. We see this first from how the critical Medicaid expansion was deemed optional by the Supreme Court. According to healthcare.gov, this was the pivotal, revolutionary part of Obamacare that would guarantee anybody who was at or above 133% of the poverty line, or at or under 133% of the poverty line, would guaranteeably get Medicaid, no matter what. But because this was optional, according to the Supreme Court, the level of care and the level of protection that Obamacare provided was mandated by what state you were in. And what we see is this is not universal. This is on a federal level, not universal and not uniform. And therefore, as a federal bill, Obamacare falls flat. Lastly, Obamacare had no capability to prevent easy loopholes from being exploited. We see this through the fact that many businesses were only working 30-hour work weeks so as to not have to pay Medicaid payments, as well as hiring less than 50 employees to avoid these mandatory payments. And Obamacare had no enforcement mechanism to ensure that businesses couldn't do this. And so, with clear loopholes, workarounds, and exceptions present within the fine print of Obamacare, the bill clearly lacks any mechanism to enforce either the public or private sector to adhere to the mission that it wanted to create. Given the three critical points that Obamacare could not accomplish its goals, lacked accessibility, and could not enforce its own policy, it is clear that there are significant negatives to Obamacare that my partner will prove outweigh any positives in our next speech. Thank you, and I now stand ready for cross-examination.
My name is Alondra Padilla. I am a first year. I am double majoring in political science and global studies with a minor in international affairs.
Yeah.
How about now? Okay. All right. Let me just quickly start over. All right. Before I begin my cross-examination questions, I would like to briefly introduce myself. My name is Alondra Padilla. I am a first year double majoring in political science and global studies with a minor in international affairs. And today I'll be working with my partner to argue the positive benefits of the Affordable Health Care Act. Now, for my first question, in regards to your claim about Obamacare implementing mandated insurance, wouldn't you agree that, as defined in the actual bill, there technically isn't a mandate, that it requires most Americans to get it, but not all?
Well, there might not have been an official mandate, but the fact of the matter is that if you didn't have health insurance, you were having to pay a fine. So it was a mandate in practice. And now the fact of the matter is that without a mandate, it only further highlights the lack of enforceability that Obamacare has as a bill that my partner and I have discussed.
Very well. Moving on to my second question, what would you say in response to the fact that the Biden administration just announced a record-breaking 14.5 million people signing up for Obamacare in 2022 alone? Doesn't that contradict your point that it is inaccessible?
On the contrary, in fact, I think it shows that it is inaccessible because this bill was created over a decade ago and people are still straggling in right now. And so what we're seeing is that the system wasn't easy in its inception and therefore we're still seeing people showing up late to the party.
But there were record-breaking numbers of people signing up for Obamacare. Is that not a clear sign that it is steering us in the right direction as more people are taking advantage of it?
If Obamacare had worked like it was supposed to, they would have already been insured.
Moving on to my third question. You brought up how the mandate requiring individuals to get insurance was repealed in 2019. Wouldn't you say that since individuals are no longer mandated to get health insurance, like you say, your entire point about it is thus contradicted or made irrelevant?
Once again, while there is no mandate anymore, a key goal of Obamacare was to increase the amount of people who have health insurance. Without any form of mandate, there's no way for Obamacare to actually do this. And so what we're seeing is that it has a lot of goals, but has nothing to allow those goals to come into fruition.
And as for my last question, Obamacare provided protection for people with pre-existing conditions to get better support. Is that not a critical benefit and testament to Obamacare's success?
I completely agree. Those benefits are excellent. But the fact of the matter is that Obamacare's benefits are contingent upon having insurance. And as I've said, there's no way to guarantee that individuals will get insurance under Obamacare because it lacks any enforcement mechanisms. So what we're seeing is that people who could be getting benefits aren't because it's so inaccessible to them.
To begin my rebuttal against my opponent and reaffirm the benefits and successes of Obamacare, I would first like to acknowledge and refute my opponent's claims. He first claimed that the Affordable Care Act failed to meet its key goals and brought up how the healthcare grandfather clause provided minimal levels of actual reform. In reality, the existence of the healthcare grandfather clause was a necessary evil in order to get more people to have insurance in the first place under the new system. Then, once these plans expired, then they would need to update them. Additionally, my opponent continuously downplayed the amount of important reform that Obamacare truly brought, ignoring the vast economic and social welfare benefits that Americans have enjoyed since its implementation. Now, over a decade since the introduction of Obamacare, more than 20 million people have gained coverage as a result of it, and it has dramatically reduced the uninsured rate. On top of that, the day that President Obama signed the act, 16% of Americans were uninsured. But in March 2020, it is only 9%. Also, as my partner previously mentioned, it has given women and children better access to high-quality, cost-effective healthcare, as it requires insurance companies to provide women's wellness services, birth control and counseling, breast and cervical cancer screenings, prenatal care, and children's immunizations at no extra cost. Next, in response to my opponent's claims about Obamacare's inaccessibility. While there's still much work needed to be done, the American people are getting more accessible and well-rounded healthcare than they were prior to the act. My opponent attempted to brush aside the record-breaking numbers of people signing up for Obamacare, 14.5 million people in 2022 alone. But these numbers do not lie. If Obamacare is truly as inaccessible and ineffective to reform as my opponent claims, then why are we still seeing a record number of people still reaching for and enjoying its benefits over a decade later? We must not forget my partner's point that as recently as March 2023, 62% of Americans stated that they viewed Obamacare as favorable. Further proof of how Obamacare is actually accessible in nature lies in the fact that it laid the groundwork for millions of people, families, and children to be covered. The most vulnerable of the American populace have been positively affected by this act, and it was crafted specifically to be most accessible, especially to those who are low income, as my partner previously explained. Finally, in regards to my opponent's point about Obamacare's lack of enforcement techniques, it might not be as strong as it could be in a perfect world, but it is undeniable that it has put us on the right track. And the current Biden and Harris administration can continue to reform the bill and help it better serve the ever-evolving needs of the public. Plus, for as much criticism as is thrown at the Obamacare's enforcement techniques, it was still strong enough to provide desperately needed help and coverage to Americans during the COVID-19 pandemic. As my partner previously mentioned, when 27 million people lost their employer-sponsored health insurance in March and April of 2020, the Affordable Care Act made sure that 79% of those people were eligible for coverage through health insurance exchanges or Medicaid, thus saving millions of lives. To reiterate, my partner and I have defended Obamacare's economic and social welfare benefits that have proven very useful and effective to the public over the past decade. And we stand besides the facts that Obamacare is providing a valuable healthcare and reform in the form of required coverage and protection for millions of America's most vulnerable individuals, including women, children, and low-income individuals, along with its record-breaking numbers of millions of signups, which have made Americans more covered than ever before, along with its continued influence that rescued millions of Americans during the disastrous COVID-19 pandemic, are all extremely valuable benefits that vastly outweigh the statements made by our opposition, and thus our points continue to stand strong. Thank you.
I will now provide the closing argument. Thank you all for a wonderful debate. Thank you to my teammates for participating, and thank you all for being here. So, once again, I'm going to highlight the critical flaws of the Affordable Care Act by strengthening the negatives argument and refuting my opponent's arguments. I will start by refuting my opponent's three main points, which are economic growth and lower deficit, accessible and affordable health care, as well as rising popularity. First, Obamacare lowered the federal deficit. Although this is a good thing, especially for young people, since we'll be the ones paying that off, it has two main flaws as an argument. One, it is a long-term goal that needed to be observed for many years to see if the predictions were accurate. And in that time, there have been significant changes made to the bill. And it also wasn't the primary goal of the Affordable Care Act because it turns out that the act was in fact not affordable, which leads into my opponent's second contention. It made healthcare more accessible and affordable. Second, inaccessibility. Like my partner highlighted, Obamacare had similar verbiage as the private sector. It is supposed to serve communities that can't typically afford healthcare. If it's supposed to serve communities that typically can't afford healthcare, then the people writing, promoting, and enforcing this bill should have understood that the people it aimed to help the most would need more accessible language than premiums, claims, co-insurance, deductibles, exclusions, co-payments, stop-loss. And contrary to popular or privileged belief, these terms are more than just one Google search away. It's actually 3 units of a financial literacy class. Then, affordable. Not only did Obamacare increase taxes for all and premiums for those who had health care, it also introduced fines for the people who had neither. Simply, the people who were too poor to pay taxes and too poor to have insurance, but somehow had to find a way to pay fines. Third, my opponent claims that Obamacare is rising in popularity. And that is only after much needed changes that were made to it during the Biden administration. It is also not fair to use COVID-19 as a crutch to gauge its popularity, because masks, nurses, and even washing your hands grew in popularity during the pandemic. Now that I've refuted my opponent's arguments, I'm going to strengthen the negatives case. My partner addressed the issues with Obamacare in terms of its execution, and I will highlight that the bill was flawed even in theory. In short, even if Obamacare was properly implemented, what they planned to implement had its issues. The two main issues were its burden to the market and its burden to the citizens. The ACA's individual mandate required everyone to have health insurance or face a penalty. Many people felt that the mandate was unconstitutional and represented an overreach of government power. Another burden to the market was that some people also reportedly had difficulty finding doctors and hospitals that accepted the insurance plans available through the ACA's health insurance marketplaces. This made it harder for people to access the care that they needed. The ACA's employer mandate also required employers with more than 50 full-time employees to offer health insurance or pay a penalty. It was criticized for creating additional administrative burdens for businesses. And now onto my second point. It created a burden on the citizens. One of the main criticisms of Obamacare is that it led to rising premiums for people who purchase insurance through the individual market. Also, some of the funding for the ACA came from tax increases on high-income earners, medical devices, and other sources. Critics argue that these tax increases harmed economic growth and job creation. In conclusion, you can see through the negatives argument that even if Obamacare was enforced correctly, what they were enforcing was detrimental to the people they aimed to serve. From being unaffordable due to fines despite being called the Affordable Care Act, to being inaccessible due to verbiage and implementation that should be able to be understood from a quick Google search. People are being blamed for not being able to carry a burden that Obamacare assured them it was going to carry. In short, it was poor in theory and poor in practice. The benefits that Obamacare provides are contingent upon having healthcare, which Obamacare has no way to ensure. With all this in mind, it is not hard to see why the Affordable Care Act, also known as Obamacare, has been a controversial issue since its inception in 2010. Thank you.
And so what you just witnessed is a sort of mockumentary style aspect of what debate actually looks like on the actual team. As you probably may have surmised from the presentation, oftentimes in debate, students are well, we're always put on both sides of the issue, but oftentimes a student ends up having to debate against something that they're actually for personally, and vice versa. And so I will tell you that when we first got this topic and we sat around the team table and we were discussing specifically who was going to be on the pro and the con side, nobody wanted to be on the con side of the debate, but right, because of, that's what happens when, you have a conscience and you're like, yes, I've thought thoroughly about this. But we knew that, for the debate itself, we had to present both sides, and we wanted to be as fair and balanced as possible. So I do want to take the opportunity personally to thank the students for getting up on a Friday morning and coming out and doing this presentation. I want to thank all of you for coming. And I, again, want to thank everybody who's been a part of our journey this year. I don't have many opportunities publicly to thank everybody who's been a part of this, but I would be remiss if I didn't take the time to thank my chair, Dr. Ethna Lay, my dean, Dr. Dan Siebold, and the provost, Dr. Charles Reardon, as well as other faculty members who were really, really key in the success and the continuing success of the debate team. And that would be Dr. Phil Dalton of the Writing Studies and Rhetoric Department, as well as Dr. Tamika Robinson, who is the Associate Dean of the Honors College. All of the people that I just mentioned have been absolutely monumental in terms of our resurgence, our renaissance, and our success this year. And I am just as humbled and as grateful as I possibly can be to all of those individuals, including my students who had no idea what forensics was until they came to my office, but believed and trusted me, and I thank them endlessly for staying along for the ride. So we have a couple of minutes, I think, left over for audience discussion or any questions that you may have. I see there's a mic here, and I'll be happy to take any questions, and certainly our students are happy to take any questions that you may have.
Good morning. Congratulations to all of you. Obviously, from where I stand, the affirmative side had all the right things. I would just make a few comments. One is, I don't think you can cite Fox News as a credible source. Two, I think, and I suspect this topic was not your main topic throughout the year, so congratulations for doing what you did here on a very short notice. But I would have cited the Census Bureau and the fact that we've got our lowest uninsured rate ever. The other thing I would say is, if you can, cite Republicans who fought against this bill. And I think one of the most amazing things that shows the popularity of this right now is the fact that 7 states have expanded Medicaid because the citizens in that state overrode their state legislatures. So I think that's really evidence that the Affordable Care Act, and I think all of us, these two individuals here, we were surprised by the Supreme Court. We were glad that they assured it was constitutional, but then they threw that Medicaid was not mandatory like it had been. And so it was a state choice. But the fact that now, for example, in North Carolina, they resisted it, and you can quote some the Republican leaders of the Senate there saying it's very important. And the other thing I would state is the states that haven't expanded Medicaid, their rural hospitals are in great trouble. So again, congratulations to all of you. Thank you.
Thank you.
Good morning. My name is Jamie Whitfield, and I actually do judge speech and debate on the high school level. And I want to commend you guys for the great work you did, especially the con side. I know that that was a hard slog, and I think you did as well as you could, you know. Yeah, you can quote as many sources as you want, but it's very difficult to, especially to deliver a side of an argument with that you don't necessarily believe in. But I just really wanted to commend you all so much for, you know, coming out this morning and presenting this to us, because it's really important for us to see speech and debate and the importance of the ability to stand up in front of an audience and present your viewpoint. It's going to put you so far ahead in business once you get out of school. Thank you.
Like Wendell, I worked on the Affordable Care Act in Congress, and I want to commend you guys for the arguments that you came up with against. I think the creativity and the way you were able to argue against the Affordable Care Act by talking about accessibility with the terms that are used was a really important point, and something that we failed to make clear in the bill and in subsequent years. So I think that seizing on that and talking about that, because it's such an important issue for an equitable distribution of insurance in this country. So I really wanted to just commend you guys for making that argument. It's one I haven't heard articulated in the way that you guys did today. So that was a really impressive thing to me, and something I'll think about a lot more. So thank you.
Just very quickly, Charlie Reardon, Provost, again, just congratulations and thank each and every one of you for just a brilliant presentation. We're so excited to have you here on campus and all that you contribute in the classroom and in your travels. Sorry about the extra hours in O'Hare, but it sounds like it was certainly worth it. And two more points I want to make quickly. One is you set a bar very high for the plenary coming up later today to talk about the Affordable Care Act. So with some of those panelists here, they know they better be bringing their A game to try to compete with you. So thank you for that. And then lastly, I do want to give a quick shout out to Professor Webb. So he was gracious enough to thank a lot of people for his being here and all of his hard work. And as Provost, I just arrived in July, and one of the first things that came across my desk was trying to hire a new leader for this group. And so I don't know why I'm thanked for doing obvious things like signing off on brilliant scholars to come here. And you know, we were so excited to be able to recruit you here, Professor Webb, and this last hour has just really demonstrated to us how fortunate we are and how fortunate the students are to have you on our faculty. So thank you and congratulations.
And just a quick shout out. I'm Kathy Primus, so I live with this every day. But I just want to tell you that Wendell was on the debate team at Iowa State University when he was your age. So keep up the good work, and you may end up in the halls of Congress or someplace like that.
Well, I think we ended at 9:30 a.m. on the dot, which is what the schedule allows for. So thank you all so much for coming, and have a great rest of your conference.